Hello, my name is Avinoam Lerner, and not too long ago, I put out a video about Dr. Joe Dispenza and his excellent work with cancer and cancer recovery. Since that video, many of you have reached out and asked me to share more about the kind of work that I do, more specifically, the mindful remission work. And you've invited me to also highlight some of the differences between our two approaches, share some of the reasons why someone would transition from Dr. Joe's approach to the mindful remission approach. So I'm going to do all that, but before I do that, I want to mention that if you've seen the previous video that I've made about Dr. Joe, you would know that I'm a big fan and that I very often promote his work, share his work certainly with my clients, because I believe he brings tremendous value to the table. Having said that, when it comes to our health, there's no one size fits all. That's just the truth of it. So my goal for this video is to share a little bit about the mindful remission with you so you can become informed and make an informed decision about what's right for you. The first reason that I want to share with you about why some people would transition from Dr. Joe's approach to the mindful remission work is that many people find Dr. Joe's work to be esoteric, a little intangible, and it's just not for them. They're looking for something that is more substantial, goal-oriented, result-driven, and that is reason number one. Reason number two is that many people want to do work individually, in other words, in a one-on-one format, not necessarily in a group format, which is for the most part the kind of work that Dr. Joe does, right? I mean, if you've been to any of his workshops or retreats, you know that these are big groups of people, sometimes up to 1,500 people in a group. So an individual or more personalized approach is a big reason why people transition into the mindful remission work. The last but not least reason is that for many people, time is of the essence, whether you're going through a health crisis or specifically dealing with cancer, because that's what my practice deal with. And if you're going through a health crisis and time is of the essence, then Dr. Joe's model is just not for you because it requires time and effort that you may not necessarily, time that you may not necessarily have, and effort you may not necessarily want to invest in. So this is just what the mindful remission does. The mindful remission is a more intensive, goal-oriented, result-driven format of a program, and it's designed to get people results fast and in real time. In other words, we can get the job done within a very short period of time. So these are the three main reasons why people transition from Dr. Joe's work to the mindful remission work. Now, a big factor in the mindful remission, the therapeutic heart, if you will, of the mindful remission, is hypnosis and hypnotherapy. In other words, hypnosis is really the heavy-duty therapeutic vehicle with which we are tapping into the mind, more specifically into the part of your mind we call the subconscious mind. And the reason we want to tap into the subconscious mind is because it is the part of your mind that governs many of your bodily functions. Think about your body temperature, digestion, heartbeat, all of which you have no conscious participation in. So we're tapping into the subconscious mind because we want to address some of the mental and psychological patterns that we know through research suppress the functioning of our immune system, right? They stand in the way of your immune system doing its job, which is to eliminate any abnormalities in the blood. So the point is that we're utilizing hypnotherapy to tap into the mind so we can resolve these patterns that stand in the way of your immune system, so that when they are resolved, your immune system can perk up and do what it's designed to do, what it's been doing your entire life, keeping you healthy. So that's the very goal of mindful remission. To do that, yes, we're using hypnotherapy. It's a very powerful modality. Now, I want to say that mindful remission is not therapy. We're not interested in analyzing these patterns. We're not interested in figuring out why they are there. We're more curious about identifying them and addressing them and resolving them so that we can actually reprogram your mind for a better outcome, a different outcome. hopefully the ideal outcome. But that remains to be seen. So this is very straightforward, the very goal of Mindful Remission. That's why we do what we do. Now, I have seen a video where Dr. Joe talked about hypnosis, and it's not his thing, which is perfectly fine. We can disagree. And I disagree with Dr. Joe not because of ignorance. I disagree with him because I've been doing this kind of work, supporting cancer patients with hypnosis and hypnotherapy. Over the past 20 years, I've been doing this work day in and day out. So I believe very strongly in the efficacy, in the power of this modality to affect the change that we desire. And I think you would agree that if someone learns about a certain modality and dabble in it a little bit here and there, it's very different than someone who is doing the work, the same work, day in and day out for a period of time of 20 years. This is, I think that makes sense, right? Hopefully. So these are essentially some of the reasons why people transition into the Mindful Remission program. I shared a little bit about the therapeutic heart of Mindful Remission. There's a lot more that I can say, but I want to keep this video short and sweet. I'll share some of the links in the description of this video so that you can learn more in your own time. And I want to mention that while there on my website, you'll find that it's very easy to set up a time for you and me to speak. Your medical team job is to take care of your physical body, but it's your job to care for the person within this body, you yourself. So that's what the Mindful Remission program or protocol is all about. And I want to share all that with you. Consultations, I should say, are free and to the point. And they're a great opportunity for you to learn more about the Mindful Remission work, for me to learn more about you, and for us to figure out whether or not you're a ready candidate for this kind of work. Because there is no silver bullet, and, well, we want to make sure that it's the right fit for you. Okay? I look forward to speaking with you and supporting you. Take care.